Welcome back to Live at 9, and it's Dr. Quinn, Mississippi's favorite doctor. And you had, I hate to say serious because everyone that comes into your office, it's a serious for them. But you had a story of a man that really needed to get checked, and it's a good thing he came into you. So I'm just going to let you take this away.
So this was a very serious scenario. The patient was a young man, less than 50, much younger than me. He was healthy, but he had a little bit of discomfort in his chest for the last year on and off when he was doing something, and a little bit of fatigue on and off. So we did what's called an EKG, electrocardiogram, and it was a little bit abnormal. His blood pressure was slightly elevated, so we referred him to a cardiologist, a heart specialist. The heart specialist did some additional tests, including an echocardiogram, and it showed that his heart had a problem with the rhythm. So he was given a pacemaker surgically implanted into his heart. And basically, the cardiologist and I talked about the patient, and it saved his life, potentially. He was someone who could have been driving, and his heart just stopped beating and went into an irregular rhythm, and he could have passed out and driven off the road or ran into a family of children with their mother, and everyone could have lost their life. So this is such a compelling story, and it demonstrates how important it is not to ignore warning signs with your body. If something doesn't feel right, you have a little chest pain, fatigue, go get checked out by your doctor and let them know what's going on, because it could be the diagnosis that could prevent the loss of your life or other people's life.
And how close could this guy have been to an issue? I mean, could it have been something that happened the very next day where he had a heart issue? I mean, are we talking about like it could have been that close?
Most definitely, it could have been that close. As a matter of fact, they spared no time. They surgically implanted the pacemaker within 5 days, because that's how important it is, because you never know. You just never know. Like me personally, I ended up having brain cancer. You can see the surgical scar. I just had a few warning signs with some numbness in that hand, and I went and got checked out. They did a CT and they saw the mass. They did surgery 2 days later, which was so vital, because you just never know. You have to be very cautious with your body and go get checked out, and don't just assume everything is going to be okay.
Right, so don't be the strong man in the room and say, I'm fine, I'm fine, I'm fine, right? Because I know you hear that a lot.
I certainly do. I had a patient just earlier this morning tell me, Doc, I don't need any blood pressure medicine. I don't need to get an EKG. I'm fine, man. I'm strong, I'm young, I'm healthy. I said, let's just check it out, brother.
Yeah, it is interesting, and I find myself guilty of this too. I mean, I am somebody that just, doesn't like going to the doctor. So I guess what's the best way to tell someone that doesn't like coming to you, hey, it's time?
Well, I actually did a speech for a men's conference, and I told the men the main reason we men don't like going to the doctor is we think we have to do the rectal exam. But now you can discuss with your doctor that you'd rather do the exam through the blood. It's called the PSA, prostate specific antigen, and you don't have to do the man test. And so many men, when I finished the speech, they followed me to the door and they said, can I come see you? Because that's the only thing that's kept me from going to the doctor.